Hey, this is Dr. Sorin. I'm going to be talking about kyphoplasty today. So what is it? A kyphoplasty is a treatment for a lumbar or thoracic compression fracture. So the compression fracture is where the bone gets squished and actually breaks. So usually that happens in somebody who's got soft bones or somebody that's taken a really significant hit. So obviously it's more common as you get older because the bones are softer as you get older. So what is it? Well, we take a needle and put it inside the actual disc. Through that needle, we can actually expand a balloon, and that balloon helps to restore some of the height back. And then once the height is restored, then we fill the bone with cement, and we try to get as much in there. Obviously, you don't want it leaking out, and so you're limited by that on how it spreads. But it's an amazing treatment, is very successful if that's the source of somebody's pain. So if somebody's doing okay and then they have a fall and they get a compression fracture, and we can come in there, expand it back and put the cement in there, those patients love us, they do great. So that's really wonderful treatment that's available. So what are the benefits? Well, first one is obviously pain relief. Like I said, the pain relief tends to be fairly instantaneous. It's pretty quick that they feel better. So they walk in hunched over with a lot of pain, they walk out standing up straight, feeling much, much better. Number two is they get improved mobility. So the beautiful thing is, once we fill that bone with cement, it's solid. So and it hardens very quickly because of the type of cement it is. And so they're gonna walk out, they're gonna have improved mobility, they're gonna be able to move much better. And so that leads us to the third thing, which is it really helps create a quicker recovery. Yes, your bone can heal itself over time, but two advantages. One is we're expanding it, so we're giving somebody some of the height back, and that may be important because where the nerves are, if the bones get squished, it can narrow the opening of where the nerves come out. So by us restoring some of the height, it can even give the nerves a little bit more space, so they're not as likely to get a nerve pinched. And so therefore they get a quicker recovery versus somebody just lets it heal on their own. And then next item, you may have a lower complication risk. So once those bones have the cement in it, they are solid, and there are risks with this procedure, but again, done correctly, it's very safe, it's a very routine procedure, and the complication rate is very low. And then lastly, probably the most important one that that patients really care about is improved quality of life. So with this procedure that can be done in an hour or two, you can have substantial improvement in your quality of life. That bone is now solid, so you're not worried about that bone getting compressed again. The bones around it might, but that bone is very unlikely to get compressed again. So it's a wonderful procedure. A lot of people have questions about it, and if you end up unfortunately with one of those, I think it's a very worthwhile procedure to consider. Give you improved pain control, improved mobility, and get you back to living your life.